Hey guys, what's up? Zach here, CrossFit all day, every day. Little tip for you. Lately, myself included, but my fiance as well, I'm sure a lot of you guys out there just suffer from the occasional kind of lingering knee pain. So maybe you've been doing a lot of squatting lately, maybe you're running, whatever it may be, or you're just working out a little bit more than usual, or just in general, like every once in a while, just from a normal routine, you may have developed some slight knee pain. So a lot of times what we're going to talk about today is just kind of the knee cap. So sometimes you'll have a little bit of burning or discomfort that's kind of stemming from under the kneecap, and that's where the issue is at. But today, the three things I'm going to give you is not actually looking at the kneecap. It's looking at the tissues that are above and below the kneecap and making sure that those are working relatively well, they're sliding well, to hopefully provide some slack to that kneecap and it moves a little bit better, okay? So, a couple things. I'm gonna bring in some voodoo floss today. So if you are familiar with Kelly Starrett and Mobility Wad, Rogue Fitness sells these as well, but these are a lifesaver. So if you haven't invested yet in some voodoo floss, I suggest you do. It's key, okay? So what we're gonna start off with first, and if you don't have voodoo floss, don't worry, you can still do this without, but we're just gonna kind of increase the effect today with wrapping and some compression work. So first thing I'd have you do, if you do have voodoo floss, is we're gonna start just above the kneecap, all right? And we're not gonna go a whole lot of compression because we're gonna be doing some smashing with this. So when you're wrapping, we just want a nice general wrap. So get it started first by pinning it down. And then this would be 100% tension. This would be 50. We're just gonna go about a 25 to 35%. So not a ton. And I want you guys to make sure that you're pulling as you're covering the top here, because we want to go after the quad today. We're not too much focused on the hamstring. Okay, so get your wrap and stay focused down in this area. You can come back over as well just to finish off your roll, and then leave yourself a safety valve. So you got a little tab here that you can pull off when needed, okay? So just make sure that that's well tucked, all right? So once you're set with your roller of choice, it could be a roller, this could be a lacrosse ball. We're gonna actually do some soft tissue work while those tissues are compressed, okay? And you may notice that you're able to get a little deeper into this. And we wanna work some movement here. So being able to pull my heel towards my butt, all right, coming out of that. And then most importantly too is do some side to side work here. Whew. And I can find right away, right through the middle of my quad, leading down to my knee. Man, that is pretty spicy. I'm having a hard time being able to pull my heel all the way towards my butt. So I'm gonna stay here. I'm gonna work this rendition a little bit. Just trying to get these tissues to break up. We're just trying to will them where we want them, okay? And then once you feel like that's improved a little bit, and go ahead and work on covering a little bit of a different area. Find maybe the lateral aspect of the quad. All right, do some smashing here. And then just keep working back and forth. And really, with the voodoo floss on, you're just kind of limited by, you know, if things start to feel sketchy, it's because they're sketchy. And also as well, if you start to lose color in your leg, that's a problem too. Go ahead and unwrap that, okay? So just working back and forth, kind of threading through these tissues a little bit until like you feel like you made some improvement. And most important is check your movement throughout, okay? Making sure that you can move that leg through full range of motion. When you're done with that, about 2 minutes or so, we want to compress the knee now, okay? So now that we've lengthened these tissues, they're compressed still, now we're going to sit back on those heels and we're going to let kind of the compression wrap do its job here. We're going to be able to see if we can sit back, see if you can tuck your heels under your butt, sit up tall. If you can create a little bit more pressure through the quad, you can sit back on this. We're just spending then another 30 seconds to a minute of just letting this compression band, this voodoo floss, do its job right now, okay? Once you come on out of that, all right, go ahead and pull the tab loose. Get this guy off the leg as quick as possible. All right, and you'll notice I have slight discoloration now and everything's starting to turn red, which means I'm getting a crashing of blood flow back in here to kind of revitalize those tissues and get them working. And just from that already, it feels great, okay? All right, so that's above the knee. Let's look at below the knee, okay? So now, a lot of times we ignore these tissues of the shin and of our posterior tib. We don't really take care of these, but think about how much time you spend on your feet throughout a day if you're a standing person, and these tissues are always on. So what we're gonna do is start halfway up, because that's where we're gonna stay focused, all right? And we're just gonna do the same thing here, working on that 25 to 35% wrap, and we're 50% overlay on the band, so we don't have any seams here, all right? And we're just gonna work up to the kneecap, and if you got some extra band, go ahead with that and tuck it. That's Ollie. He's being guard dog right now. Okay, so then now you got this lower part wrapped, so now we're focusing on these tissues below the knee. Now I suggest going to a lacrosse ball, okay? Getting in more of like a pigeon shape, okay, for my yogis out there. And then using that ball and the pressure from the compression to then get into these tissues and access them a little better than maybe you're used to, okay? So now that you've found and placed that ball right next to that shin bone, all right? And then once you've found that, you could even contract. So try to flex the tissues of the shin into the calf, and then release. And then do a little peeling from side to side with that. And just stay focused up towards the knee, okay, right? That's our focus today. If you got any type of knee pain or that little burning maybe going on under the kneecap for a few weeks that you just haven't been able to get rid of, this is the key, okay? So smearing from side to side. Doing some good breathing as well. You know, tell your nervous system to kind of chill out here when you're doing this work. If this is pretty difficult for you to bear, then take your time. You don't need a ton of movement. This doesn't need to be necessary. You know, more movement doesn't mean you're mobilizing more. So take your time, find those stiff areas, contract, relax, move it in and out, side to side, and just kind of worrying these stiff tissues on the front of the leg, that lower leg, and getting them to soften up, okay? So same thing here, about 2 minutes, and then we're gonna go back to closing it down, okay? So we're gonna go back to that position of heels under the butt, okay? And think of just, you're trying to press your shins into the ground here, okay? So you're trying to use your body weight, pressing those shins into the ground. If you can handle a little bit more in this position, you can lean back to try and really open those tissues up. Always focused on breathing, allowing yourself to settle in. And just think here, about a minute here will do just fine, okay? Nothing crazy here. By that time, after a minute, you're probably most likely definitely ready to take the band off, okay? So I get the same effect, all right? And always test, retest, guys. So now I have a comparison. I can test my side that I just mobilized compared to my side that I haven't mobilized, just with some simple air squats. And man, can I feel the gliding so much better in this knee. It's very smooth, nothing's creaking or popping in there. That's just what we want, okay? All right, last thing then today. You've done some soft tissue work, you use the compression band if you have them. We're gonna finish with the couch stretch, okay? So we're gonna really focus on, this could be a wall, could be a box, whatever, doesn't matter, okay? But get that knee buried into the corner of that box, all right? Your other leg is out in front, all right? And most importantly, when you guys start moving here up, I need you to squeeze your butt, okay? So squeeze your butt, hold it, and then see if we can take this guy up into a higher position while my butt is squeezed. And then I'm gonna work on pressing my hips back to the box. Oop, box kind of slipped there, okay? Back into the box to finish this one off, okay? And same thing here, when you're in this position, try to find a minute, 2 minutes. Hell, if you can go 3 minutes, go 3 minutes, okay? We're working that. And this is just a starting point too. Realize that as well. So, you know, if I'm having some discomfort in my knee, let's give this a try, see what it does for you, and let me know what you think. See you guys later.